Hello, this is Robin Pearson Booth. This is the simulation for patient education for patient Becca Humphrey. Hello, Miss Humphrey. Congratulations on the birth of your new baby. I'm a nurse and I am going to go over, and my name is Robin. I'm going to go over some pain management teaching so that you will be as comfortable as possible when you go home with your baby girl. I want to let you know what's normal expected pains and some non-pharmaceutical, non-narcotic ways to deal with that. We want you to be able to rate your pain on a scale of 0 to 10 and to help determine what is an acceptable level of pain for you. We want to know what makes that pain better or what makes that pain worse. So along with some written information about what I'm talking to you right now about, we'll give you a log so you can keep that. You can take that log to your doctor, and if y'all need to tailor your regime at home, you'll be able to do so. So some normal expected pains is uterus contracting, which may be described as crampy pain. And this can last 7 to 10 days. What often helps this is walking. You can also use some ibuprofen, and that might help that sensation not be as unbearable. Another area that can cause discomfort is where you had your episiotomy. You can use ice packs. We've given you some of those in your little goodie bag, and you can put ice in there and apply it to your perineal area, which includes your vagina and your rectum, and that will help that swelling in that area. Another thing that might help is sitting in a warm water in a bathtub about 3 to 4 inches a couple of times a day. So it's also important to sit squarely on the chair or bed, not leaning from one side to another, because that can put undue tension in that area. And along with that, another thing that can reduce that tension is when you're bearing down to have a bowel movement, you might use a piece of toilet paper to hold those stitches so that that doesn't put undue stress for that. I mentioned using the ice packs. That's also good for your hemorrhoids. That will help reduce that inflammation. And ibuprofen will also help reduce the inflammation in both where your episiotomy was and your hemorrhoids. So with that, you want to be sure that you keep your bowels soft. You want to drink lots of fluids. That's important. If you're breastfeeding, then that will also help your uterus contract and decrease those pains that I was talking about earlier. If you take some of the narcotic pain medication that the doctors provided for you, you also want to stay on a stool softener as long as you have that pressure from your hemorrhoids and from the episiotomy. You want to not strain if at all possible. So, of course, any intense new pain you want to alert your physician about. We don't want you to have something happen, and usually a sharp, intense new pain is an indication that things might not be healing as well. But predominantly, your best friend is going to be ice, those warm sitz baths, and ibuprofen. And that all of that helps reduce that inflammation and keep those tissues from sensing that pain. The sitz baths help soothe things in a different way and keep the tissues with good blood perfusion, and that will help with that healing. So again, congratulations and good luck.